My name is Luisa Vega. I'm a doctoral student at Duke University, School of Nursing, and this video is regarding healthcare policy changes in Florida. Not long ago, I saw Sheila's post on Facebook, and she wrote, "I'm at Moffitt Cancer Center starting chemotherapy today." Later that day, I spoke to Sheila, who told me that she was being treated for an aggressive invasive tumor that could leave her in a wheelchair for the rest of my life, she said. Sheila is my neighbor's 17-year-old daughter, and I have known her since she was 10 years old. Sheila's condition could have been prevented if she had had timely access to a primary care physician. However, her parents had to wait almost 2 months between appointments to see Sheila's primary care doctor, while this tumor rapidly grew inside her body. Just like Sheila, approximately 20% of Floridians, or more than 3 million people, live in medically underserved areas. These are communities that generally have fewer physicians, fewer nurses, specialists, and other healthcare workers. And it takes much longer for a patient to see a primary care physician than in an urban area of the state. This lack of access to primary care physicians leads patients to have poorer health outcomes, more negative health outcomes, while also leading to increased healthcare costs for the state of Florida. Often, as in Sheila's case, many patients suffer the consequences of untreated malignancies while awaiting for appropriate care. With the Affordable Care Act and the opening of the healthcare exchanges, many more Floridians will have access to healthcare. However, as the demand for primary care services increases exponentially, the existing shortage of primary care physicians in the rural areas will continue to worsen. Ensuring access to primary care that meets the increased demands associated with the expanded insurance coverage and a larger rural population is a major policy concern. One way of improving access to primary care is to ease Florida's current scope of practice laws for nurse practitioners. Nurse practitioners are registered nurses who have acquired, through a master's, postgraduate, or doctorate degree, advanced clinical knowledge and skills in diagnosing, determining treatment, and prescribing medication. Nurse practitioners provide a wide range of cost-effective primary care services similar to primary care physicians. More than 30 years of research support the role of nurse practitioners in meeting the nation's growing need for primary care providers. Nurse practitioners provide more disease prevention, counseling, health education, and health promotion when compared to physicians. Clinic runs by nurse practitioners result in cost savings associated with reduced costs of emergency room, urgent care centers, hospitals, and emergency medical service. Currently, the clinical role of nurse practitioners is governed by the scope of practices laws. Florida laws require that nurse practitioners work in collaboration with a supervising physician and pay these doctors a fee. However, the physicians are not even required to be present or sign off when the nurse practitioners render their services. Strong opposition by the powerful Florida Medical Association has blocked efforts to loosen these restrictions. Changing Florida restrictive scope of practice laws will allow non-physicians primary care providers, such as nurse practitioners, to diagnose, order tests, write prescriptions, and make referrals. This change could increase the capacity of healthcare agencies offering primary care, especially in the rural areas. This flexibility can help ensure that patients are seen in a timely manner and an efficient manner as well. The American Medical Association concedes that there is no evidence that patients cared for by nurse practitioners receive inferior care or have different health outcomes than those cared for by a primary care physician. Medical literature also supports the use of nurse practitioners to help fill the gap. According to an October 2012 report in the journal Health Affairs, a review of 26 studies published since 2000 found the health care status of patients, their course of treatment, and prescription rates were consistent between nurse practitioners and physicians. In the past 2 years, a growing number of organizations, from the National Governors Association to Florida's Tax Watch, have emphasized the need to ease the scope of practice restrictions on nurse practitioners to help meet the growing demand of primary care services. But currently, there's only one bill awaiting legislative approval to expand nurse practitioners' scope of practice. and it seeks to allow nurse practitioners to initiate involuntary psychiatric examinations under the state Baker Act law. As a nurse and future nurse practitioner who lives in a rural, underserved area in Florida, my dream is to be allowed to practice to the full extent of my capacity. I would like to work in a state in which politics and policies do not interfere with the patient's access to care. I would like to see Sheila walking to receive her high school diploma and not be in the wheelchair she could be bound to because she was denied access to see the doctors who might have prevented the tumor from changing the course of her life. Thank you.